Hi guys. Sorry, let me fix the camera a little bit. Hi, my name is Torin. For those who don't know, I am a practical nurse. I just finished my nursing program 2 weeks ago, and I'm totally excited. I take my NCLEX in a couple days, and I am excited and confident about that I will pass. So by the end of this week, I will be a licensed practical nurse. So be on the lookout for more videos on that. But today I wanted to discuss LPN job description, RNs, and RN with their BSN. So I'll start off with LPN because that's the license that I will be carrying. So LPNs, usually for LPNs, the schooling some places is 10 months, 12 months, and as long as 18 months to obtain your practical nursing, and then you go for your LPNs to actually be licensed. So you're not licensed until you pass the NCLEX, basically. You know that. Okay. So yeah, the difference between a licensed practical nurse and an RN. RN you would see in a hospital setting. They are still in nursing homes, rehabs, because it is required that an RN or an RN with their bachelor's to be on the floor in a nursing home or rehab under above the LPN. So the LPNs work under the supervision of an RN or RN with their bachelor's degree. You don't see LPNs doing IV therapy, assessments, patient teaching, supposedly, according to the books. But when you do your clinicals and if you have family in nursing homes or rehabs, you see that licensed practical nurses do assessments. They do patient teaching, and they are nursing supervisors. In a lot of places, you see LPNs as nursing supervisors, and a lot of RNs actually look up to LPNs for resource, because some LPNs been LPNs for years, and they know the hoops and loops through things in their facility. So a lot of RNs, they do go to LPNs for advice. And so into our RN, RNs, they job description is like endless for them. They obviously do assessments, they do their IVs and everything like that. It's very endless. There's nothing that differs from an RN and an RN with their BSN. Even the pay, like the pay is the same for new grads. It just your pay after over the years, as well as LPNs, you just make an increase because of your level of experience. But there's nothing that an BSN can do that an RN cannot do. The only time it differs is when you have your bachelor's and you want to do management. So an RN with their associates cannot do management things. So that's the only time you'll see a BSN making a great amount pay difference, is when they go into management or finances. But far as far as bedside job description, an RN and a BSN is the same, so they pay the same. So if I'm not mistaken, like a lot of facilities, they are not. It's not mandatory for them to pay an RN with their BSN more than their RN who has their associates, because you have the same job description. You're doing the same thing. Even some nurses who go for their masters and still have the clinical bedside job description, they still don't make more, and if they do, it's probably like a couple cents or $1 more. It can vary from state to state, but particularly you would see that an RN and a BSN would get the same. If I want to go back to LPNs where I live, they make in the mid 20s, high 20s. A lot of places where I'm looking into, I will be looking at $28 an hour. There's some places here that pay 21. I would not settle for that. I'm looking to go into a place that will pay me, a great amount. I think anyone will be interested, but sometimes when you need a job and you need a job fast, you get your experience, you start somewhere, and that's the important. You always start somewhere to get, further. It's those little steps that amount to something big. So yeah, and also another thing is too, some places you'll see LPNs is in jail facilities, like RNs. They can work in correctional facilities as well as LPNs. And you can see sometimes LPNs can make more than a new grad RN. And I know you're probably like, this girl's bullshit, and I don't sit here in front of this camera to bullshit you. It is true. I have a lot of nursing friends, and obviously my clinical instructors all had their master's degree, and they worked with LPNs, and some of the LPNs did make more than them, in their time of working. You would see that if you ask around. So, but that's not a new grad LPN or an LPN who obtained her license within a year and has a year worth of experience. It's probably someone with 5 years, 10 years of experience compared to a new grad RN. I don't know if you kind of grasp all that. But yeah, so LPNs, we're not really in hospitals, but there's still a lot of job opportunities, and I think that it is worth it. It depends on what you have going on in your life. If you're young and you're fresh out of high school, still live with your parents, and you can get into a BSN or RN program, shoot, go for it. But me, myself, I'm a single mother. I have bills to pay. I have little siblings, nieces, nephews, so the LPN track was faster. I was like, I don't want to be waiting on the wait list for an RN program, which this year would have been my second year on the wait list. But look, I'm licensed as a practical nurse, so I can get that clinical experience in, so that I have an advantage when I go back for my RN, hopefully within a few months, or the fall of next year, because I can't start in spring because I already have those prerequisites and those the foundation of nursing courses already due to my LPN program, and I have prereqs from the past college. But yeah, so like it just all depends, and don't let any RN with their associates or bachelor's degree discourage you. Like, no, LPN's not worth it. It's totally worth it. Like, you get paid more if you're a CNA. Usually, if you're looking into nursing, you become a certified nursing assistant. If you are a CNA, you obviously get paid more than that as an LPN, so it can get you on your feet, and it can give you a couple more dollars to actually pay for school as well, and help you with bills while you're in school. So LPN is totally worth it. It was worth it for me. I'm a single mother. Like I said, bills and family members to look after. It was fast track. I did not want to wait on a wait list. But if you are young, still living with your parents, or even if you're a little older, mid-20s, 30s, still living with your parents, and you can go into an RN program or BSN program, go for it. It just all depends on what's going on in your life. So it doesn't matter, but don't let anyone discourage you on your journey, because your story is meant for you, nobody else. And always remember that it's those small little steps that amount up to something. When you start off with huge, big steps, you can be successful, but it seems like the most successful people always started from something so small. Something so small that just opened so big that amounted up to something so big. So just don't let anyone tell you anything different. You start in your steps and your pace. It doesn't matter how old you are, how young you are. You know what's best for you. So be positive and have the confidence to make your own decisions. But that's a brief talk about LPNs, RNs, and BSNs. I know there's probably a lot more that I could have talked about, but that's what the comment box is for. And also subscribe. Please subscribe, because I will be posting more frequently now that I am done with school. The biggest stress, but it's so worth it. So worth it. I'll be posting more. And I look forward to hearing your feedback, and I look forward to reaching out. And if you need me to do any research on any states that you live in, I'm willing to help. You can inbox me, comment below, follow my Instagram. It's melanin_Torin. And then my Facebook is Torrin Harrison, so you can go and follow me on those pages. Ask me any questions. No question's a dumb question. And like throughout my experience, I hope that I can help. And like I said, I can do research on schools in your states that you're in for you. I will take time out of my day just to do that. So utilize me, subscribe to me, and support. But it was nice doing another video, and God bless you all. I love you all. Bye.